All right, welcome back. We are checking in on your health with Naples Urology Associates. Here with more is Dr. Mark Gutman. Great to have you on the show this morning.
Thank you for having me.
We're talking about a very important issue today, who should be screened for prostate cancer, and kind of delving into the different options with that. And I've just, in the last couple seconds here, have been learning a lot about it. I'm so happy to have you on the show this morning.
Thank you for having me.
When it comes to prostate cancer, I was asking you too, I had a family member who had it, and I remember it being kind of like a silent killer. There weren't any symptoms when he had it. One day he was just diagnosed, and that's where that journey began. So is that typically how it goes with most patients?
It can, and that's why screening is so important. Usually what we want to do is you want to assess people and see if their 10-year life expectancy is good. If it is, then those are people that you want to focus on and make sure that we find something sooner rather than later.
Yeah, absolutely.
And the real trick here is there's a lot of different types of prostate cancer. Some are more aggressive, 10% of them are more aggressive. The other ones, there's a lot of them out there that you really don't need to treat. So, do
you know when you find it what kind it's going to be? If it's going to be the slow growing or the slow developing or the fast?
Sometimes you do, but there are when you find them early, you don't know if it's going to turn into a tree or if it's just going to stay
change at any time.
Like a little bit of something that's slow growing and something that really won't bother someone.
Gosh, how scary. Well, how do you work up patients that are at risk for prostate cancer?
Usually we do a risk assessment, and we see the first part is to do a rectal exam and a PSA. Those are the two mainstays. Usually by the time I get them, they've had those, and patients come to me, and then we want to see what's their actual risk level. We do a few further tests. One's called a PHI, which tells us pretty much their risk assessment. And the average risk for the population is about 1 in 6 for men.
1 in 6, my goodness. Wow.
And then what we want to do is we want to see which ones do we really need to find that is actually going to affect them. A lot of prostate cancers really won't affect people. So that at the same time, but you want to find the ones that really need to be found now.
Absolutely. So how has the MRI fusion changed prostate cancer diagnosis?
So pretty much now the MRI will not detect the lower grade cancers that we don't really want to find. So that's the biggest boon for it. It misses about 30% of the low intermediate cancers. And but what it does find is the stuff that we need to find now. So based on the MRI, we can actually say, hey, this is something that we need to check. And it doesn't necessarily mean there's cancer there, but it does mean that you need to look at that area.
Right.
And what we do then is we can actually take that MRI and put it into our biopsy format and target those spots.
Wow.
And once we can do that, we're in good shape, and we can tell people what's there.
Certainly thankful for that technology these days. What about the type of patients that would benefit most from the MRI fusion?
So the way that I use it is I offer to all patients that come in right off the bat, because I think if you're going to do a biopsy on someone, you should do it right the first time, and you should have all the information that you need. The ones that it's really slated for are the people that have had negative biopsies, and they're ones that they have risk factors, their numbers are high. We're a little bit worried about there's something going on there that we can't find because we've checked and there's nothing there. The old way to do biopsies are blind. So about 40% of the time they're positive, but that means that 70% of the time they're negative biopsies, but that doesn't mean the patient doesn't have cancer. You could be 2 millimeters over when you put your needle in and miss something that's there. The point of the MRI guidance and the MRI fusion is that we can actually target the areas where there is the most risk and the lesions that are, and we can tell someone, hey, this is what you really have here. And then when we take, if you do a prostatectomy and we take the prostate out, if we do radiation, whatever it is, we treat them, we know we're treating the right cancer, and we didn't just nip the edge of something else that's there and there's something looming that we just totally missed.
Right, very important. Well, if you want to check in on your health as well or learn more about what Dr. Gutman spoke about, you have several locations, but you are actually available at 2 different locations, and that's Naples and Marco Island, right?
Yep, that's right.
So
downtown Naples, East Naples, and Marco Island.
Perfect. And then that website, urologyofnaples.com, if you want to learn more about them there. We've got the information on the screen there. Any final thoughts you want to leave people with as we go?
I just want to say hi to my wife and my 2 daughters.
Well, hello, family. Thank you so much. It's so great to have you on. Some important information there. And be sure to check out our website as well if you want more on Naples Urology Associates. Head to fox4morningblend.com.